Hi, my name is Adalgiza. I'm creating this video as part of my application process into the Faye W. Whitney School of Nursing, Bachelor's of Science in Nursing brand option. I will be answering 5 questions in the order that they appear in my application. I will be reading questions number one, and subsequently I will answer, reading my answer for the question number one, and I will do so until the 5 questions are completely done. Question number one. Describe a meaningful experience or difficulty situation related to a course, an extracurricular activity, or in your personal life. Discuss how this experience exemplifies your ambition and enthusiasm for learning. For that question, number one, my answer was it started right few months after I finished my first bachelor's. I had my baby was small. She was 3 months, and I decided to just sit back in the house and take care of my baby until she got a little bit bigger. And I also needed to know what do I want to do for my professional career. And I was not yet sure about what I wanted to do. So I just decided to observe and take a deeper look inside of my own self and see if I could find something that I identify myself to as a career and follow. So I was then towards the end of summer of 2018. I started doing a private home at home care to assist a woman with her advanced age mother. The mother was somewhere like 97 to 98 years by the time she passed. And then I started taking care. The old lady was under hospice care at home. So the hospice care take givers would come, the nurses would come to take care of her. But when the hospice care nurses were not there, I was the one staying there to take care of the old lady. And time passed, and then I in 2019, towards the end of summer, fall, close to fall already, the old lady passed away, unfortunately. And I was no longer needed to help with that. The daughter called me and asked me if I have ever thought about becoming a nurse or a healthcare provider. And I told her, like, I never thought about becoming a nurse, but I liked the experience I had helping her mother. It was fulfilling to me to be able to help somebody who couldn't help themselves. And sometimes when I would see the smile of on her mother's face, even though she couldn't talk, but she would touch my face sometimes and smile after I care for her, I feed her. It was very rewarding for me, and that touched my heart and made me happy. That's what I told the lady. And she told me that she needed to do something in honor of her mother because my mother was a nurse. And she said, please, I have an offer to give to you, but you don't have to accept now. Just tell me if you will think about it, which she offered to pay for my CNA license in honor of her mother. So I came home and I thought about it, and then I got back to her and I said, yes, I would take the opportunity. So I went ahead, I took my CNA classes in a skilled nursing home facility. And then over there, after I finished my classes, I started doing my clinicals. And after my clinicals, they liked the work I was doing during clinicals, and they asked me if I would like to work for them. So I didn't leave after my clinicals. I got my license and I started working there as a CNA. And I worked there for the Next, I did 2 years. I worked over COVID with them, over that shortage of people to work. I was there, and it was a very good experience, and that made me be even sure that that's what I wanted to do. So after that, working as a CNA in the nursing home facility, I I think that that's what sparkled my desire to go back to school and obtain my nursing degree so that I could better serve the people that I was caring for. Um, Question number two, why is nursing the profession for you? How do your personal values align with the professional nursing values? I believe that I have the personality traits that allows me to remain patient, kind, and compassionate, caring for others in difficult situations. And I am also able to be self-aware of my emotions and the others around me, which demonstrates the emotional intelligence needed to be a nurse. Um, I have a critical thinking skills that allow me to work under pressure with a diversity of team members that creates an environment of flexibility and the open communication to ensure that best practice and that the patient's well-being is the number one priority. So I think that having those qualities would align with the professional nursing values. Question number three, the field of nursing consists of working with the healthcare team members from a diversity of backgrounds and experience. Describe a time when you worked as part of a highly diverse team. How did the diversity enhance the functioning of that team? For question number three, I I would use the same my experience in the skilled nursing facility where I worked is where I worked because I was lucky to have a team of practitioners from a diverse background and cultures. But we used our background differences, cultural upbringings, and the world views as an opportunity to learn from each other and to solve situations that ended in the best practice to our residents. This diversity within our team helped strengthen our practices and care for our residents because we also had a very highly diverse resident population, which required a unique plan of action and care. So, question number four. Question number four. Describe a time when you did not agree with a decision made by a boss, a parent, teacher, or coach. How did you approach this and what was the outcome? For question number four, I will talk about an experience that I had that I would say, was one of the hardest situation I ever had in my professional career so far. I started working in a private clinic as a CNA, as a medical assistant at that time. And then I had a supervisor that was training me. And that supervisor, from the first day that start training me, would sometimes say words like, this is not for you, this is not for everybody. And it happened more than four times. So the fifth time when that happened, I talked to the supervisor kindly and I said, hi, I have noticed you telling me that this is not a profession for me. And you have done that more than 4 times. This is the fifth time, and I'm not comfortable with that. I don't think it's right for you to try to determine what is good for me or what is good, what's not good for me. I would really appreciate if you would, stop saying that because it hurts my emotions. And the supervisor said, well, it was not on purpose, that it never meant to say that, and that I misunderstood. So I let it be. And then what started happening was I was training also with the other people besides the supervisor, but the supervisor kept giving bad reports about me to the HR and were things that were not true. And then other people that was training me was going to give other reports that were positive, including some of the providers. So the HR person got confused and called me to hear from me, and I explained the situation. I said how things were. And then since I was working for 3 months probation time, that after those 3 months, then they would determine if I stay or not. Because of all that situation and some other problems that the supervisor created and they were not true, the boss initially they called me and said that they wouldn't do the final contract with me when the 3 months was over, and they sided with the supervisor, claiming that the supervisor had seniority over me, and it was hard for them to like go against that supervisor. And it just came down to that, and they had to let me go. But then 2 or 3 days after, they asked me to go and explain my side of the things that the supervisors told them that I did, and I didn't do it. So I went and I said my side of the story. I pointed at, even the owner of the clinic was one of the person that was working with me in the day that the supervisor said that something I did that I didn't do. He could prove that that was wrong. It never happened. So then they called me. They said the owner of the clinic and the HR the next day called me and they said, I'm sorry, you could come back to work for us. We didn't mean to be that unfair. And I had to make that hard decision for me by declining the offer to keep working with them because my ethics and morals did not align with what I saw as a professional health organization holding to unethical and unfair practices. So I had to decline to work with them. And that was hard for me because I really liked to work in that place. It was just that one situation with that one supervisor. So, but thank God I was able to prove that I didn't commit what the supervisor said that I did. So that was my hard situation. So I had to decline the job. Question number 5. In life, we are faced with situations where we do not feel a strong sense of confidence and we question our own ability as a nurse. You will be facing with such a situations. Describe a time when you were faced with a situation that challenged your confidence and sense of assurance. For question number 5, my answer is this actual semester for me is the most recent and ongoing situation that has challenged my confidence and sense of assurance in the field of nursing. The course content and the challenging and has elevated medical and the technical information to the next level. And while trying to absorb and maintain the course material, I'm raising a baby that cannot be on a daycare for now. And I'm having to take care of my other 2 daughters. My husband helps, but as of for the past 2/3 of this semester, um, he has been hospitalized. and I have been unable to fully care for the baby and our other two daughters as I should, like fully, properly the way I wish I would. The challenging course content and the health struggles in the house and general stressors of the day-to-day life made it difficult to me to perform in a level I believe that I should in my class. But so as a result, some low performances on the exams hurt my confidence and my abilities to practice in this field. But yet, improvements on my performance as of the lately and my determination to excel as a nurse helps my confidence to be high, and I will pass the course. So that's my answer for question number 5. Um, Thank you so much for your time and attention.